The Onodi cell is formed by the posterior pneumatization of the most posterior ethmoidal cells, often extending laterally over the sphenoid sinus. Because the Onodi cells are posterior ethmoidal cells that are positioned superolateral to the sphenoid sinus, the optic nerve and carotid artery may often course through the lateral aspect of the Onodi cell instead of the sphenoid sinus proper. Stamberger often defined Onodi cell as a posterior ethmoidal cell with an endoscopically visible bulge of the optic canal. This is an Onodi cell, also called the sphenoethmoidal cell. This is the posterior ethmoidal cell, lateral and superior to the sphenoid sinus, and frequently has intimate relation with the optic nerve. Cells derived from the ethmoid lying within the sphenoid bone were referred to as Onodi cells, named after the Hungarian surgeon by Lang in 1989. However, this definition differs from that adopted by Stamberger, who defined the Onodi cell as a posterior ethmoidal cell into which the optic canal made an impression, a tuberculum nervi optici, on CT examination, or a posterior ethmoidal cell into which optic canal made an endoscopically identifiable impression. The posterior ethmoidal cells can become pneumatized far laterally and to some degree superior to the sphenoid sinus, in which case they are called sphenoethmoidal cells or the Onodi cells. Pneumatization of the clinoid process in those cases may originate from the posterior ethmoidal cells also. The optic nerve and carotid artery may be exposed in an Onodi cell, and this is clinically significant because the sphenoid sinus is located medially and inferiorly to the most posterior cell of the posterior ethmoidal complex. Consequently, attempts to use instrumentation to locate the sphenoid sinus directly behind the last cell of the posterior ethmoidal complex may result in serious damage to the optic nerve or carotid artery. That is an Onodi cell, the most posterior ethmoidal cell. An Onodi cell is defined as an ethmoidal cell that lies posteriorly and sometimes superior to the sphenoid sinus. As a result of its location, the optic nerve and less commonly the internal carotid artery are very closely related, with as little as 0.03 millimeters of bone separating them. Potential damage to the optic nerve and internal carotid artery occurs when attempts to enter the sphenoid sinus endoscopically by passing through what is thought to be the posteriormost ethmoidal air cell instead of an Onodi cell. Additionally, isolated mucoceles of the Onodi cells, squamous cell carcinoma and sinus disease have all been reported, leading to early optic nerve involvement. This picture shows a posterolateral pneumatized sphenoethmoidal cell, also called the Onodi cell, engulfing the optic nerve, seen magnified here and radiologically here. Sometimes one might be misled. Here we have an anteriorly attached sphenoid intersinus septum, mimicking thereby an Onodi cell. The paranasal sinus anatomic terminology group defines the Onodi cell as the most posterior ethmoidal cell which pneumatizes laterally and superior to the sphenoid and is intimately associated with the optic nerve. Using this definition, the incidence of Onodi cell is 8 to 14%. The occurrence of optic nerve neuropathy caused by pathologic process in an Onodi cell is explained by the close relation to the optic nerve, because it often runs within the small cavity of the Onodi cell. An isolated mucosal of an Onodi cell causing optic neuropathy is rare. There was a case report of acute visual loss caused by an isolated mucosal of an Onodi cell. The Onodi cells must be removed to completely resect tumors located in the cellular region. The Onodi cell was first described in 1903 by Professor Adolf Onodi, 1857 to 1919. He was a professor of laryngology at the University of Budapest. The reported incidence of Onodi cell varies widely from 3.5 to 51%, a consequence of the different criteria used to define it. Posterior ethmoidal cells that are intimately proximal to the optic nerve are considered to be Onodi cells. They may extend posteriorly beyond the anterior part of the sphenoid sinus, either superiorly or superolaterally. Stamberger wrote that these cells may or may not contain the tuberculum nervi optici, which is the bulging of the optic canal into the wall of the Onodi cell, and according to this theory, patients may or may not have the defined Onodi cells. In a typical case of Onodi cell, one should look for a bulging of the optic nerve, which should run transversely along the superior portions of the posterior wall of the Onodi cell. One should also notice an infraoptic recess. Bulging of the internal carotid artery may be present infromedially. The presence of multiple posterior ethmoidal cells that extend beyond the anterior part of the sphenoid sinus superiorly or laterally has not been described. Awareness of the presence of an Onodi cell or multiple Onodi cells is important prior to dissection in the sphenoethmoidal area. The sphenoid sinus is normally situated behind the posterior end of the posterior ethmoid sinus. Assuming that the posterior wall of the Onodi cell will lead to the sphenoid sinus might result in an adverse event if the posterior wall is penetrated. Awareness and knowledge of the surgical anatomy of each individual patient prior to surgery are of utmost importance. And this is an intersinus septum inserted into the bony covering of the right carotid artery. Halar cell. Halar cells are also known as infraorbital ethmoidal air cells or maxilloethmoidal cells. They are extramural ethmoidal air cells that extend into the inframedial orbital floor, and these are present in 2 to 45% of patients depending on their exact definition. That is a halar cell in the inframedial aspect of the orbital floor. They may become clinically significant in a number of situations. It might become infected with the potential for extension into the orbit. It may narrow the ipsilateral osteometal complex if large and may thereby predispose to ipsilateral maxillary antral disease due to obstruction. And finally, it may lead to inadvertent entry into the orbit if unrecognized at endoscopic surgery. That is a left-sided halar cell. This is named after Albrecht von Haller, who was a Swiss anatomist, 1708 to 1777. In 1751, he founded the Swedish Royal Science Association, of which he was president until his death.